Next topic is the metabolism of galactose. Galactose, which is metabolized from lactose, which is a disaccharide, formed from the glucose as well as galactose. And it enters glycolysis by its conversion to glucose 1-phosphate. Conversion of galactose to glucose 1-phosphate is called as Laloir's pathway. And what is the source? It is mainly produced from the milk as well as dairy products and the intestinal mucosal cells, where the enzyme lactase or beta-galactosidase hydrolyzes lactose to galactose as well as glucose. And the lysosomal degradation of glycoproteins and glycolipids within the cells produces galactose. And what is the site of metabolism? The galactose is metabolized in the liver, that is cytosol. And if we talk about the metabolic reactions of the galactose in the cytosol, at first the galactose is phosphorylated by utilizing an ATP to form galactose 1-phosphate in the presence of an enzyme called as galactokinase. And this galactose 1-phosphate reacts with the UDP in the second step in an exchange reaction to form UDP-galactose and glucose 1-phosphate in the presence of an enzyme galactose 1-phosphate uridyltransferase, which is the rate limiting enzyme of the galactose metabolism. So UDP-galactose on condensation with glucose gives lactase with the liberation of free UDP in the presence of an enzyme lactose synthetase. So UDP-galactose also forms an active donor for many other compounds like glycosaminoglycans, glycoproteins, cerebrosides, and also for the glycolipids. The remaining UDP-galactose is converted into UDP-glucose by an enzyme called as hexose 4 epimerase. So this converted UDP-glucose is used for the synthesis of glycogen. So the glucose 1-phosphate, which is produced in the earlier step what we discussed earlier, is converted to glucose 6-phosphate in the presence of an enzyme phosphoglucomutase. So this glucose 6-phosphate enters into glycolysis for the production of glucose. And what is the alternative pathway for this? Enzyme called as galactose 1-phosphate pyrophosphorylase or G1P uridyltransferase in the liver, which will become active only after 4 to 5 years of life, and this enzyme will produce UDP-galactose directly, which can be epimerized to UDP-glucose. Now let us concentrate on discussing the disorders of galactose metabolism, and the first one is classical galactosemia or type 1. It is an inborn error of metabolism and it is inherited as autosomal recessive disorder, and the enzyme defect is mainly due to the deficiency of an enzyme galactose 1-phosphate uridyltransferase. So, and it is mainly due to the accumulation of galactose 1-phosphate because the deficiency of this enzyme. And what are the clinical features we can see over here? Poor feeding behavior, failure to thrive, bleeding problems, and the symptoms in infants after consuming lactose or galactose includes the following. That is, infants will exhibit vomiting and diarrhea following ingestion of lactose, impaired liver function, hypoglycemia, weight loss, hyperbilirubinemia, hepatomegaly, hypergalactosemia, and metabolic acidosis and hyperammonemia and hyperaminoaciduria. All these are the features what we can see over here. If patient left untreated, it leads to fatal complications like cirrhosis, mental retardation, and blindness. So blindness is mainly due to the conversion of the circulating galactose into galactitol, which is also called as dulcitol, by an NADPH dependent aldose reductase. And high levels of dulcitol or galactitol accumulation causes osmotic swelling, which results in the formation of cataract and finally leads to blindness. And the long-term complications of this disease includes developmental delays, speech problems, and premature follicular atresia that leads to sterility. And the second one is type 2, which is type 2 galactosemia. It occurs rarely and seen in the people who consume milk or dairy products, and it is mainly due to the deficiency of an enzyme galactokinase. Hence, it is due to the accumulation of galactose. So, deficiency of an enzyme galactokinase also leads to galactosemia and galactosuria, but it does not lead to hepatorenal complications like we studied in first one. Next is type 3. It is mainly due to the deficiency of an enzyme UDP-galactose 4 epimerase. It is of two types, benign form and the severe form. Benign form has no symptoms and it requires no special diet. But the severe form has symptoms similar to that of galactosemia type 1, but with more neurological problems, that is seizures. So the diagnosis, if there is any suspicion in the newborn, immediately screening test has been done. And that is, what is the newborn screening test over here? Blood from a 2 to 3 days old baby screened for any high levels of galactose and galactose 1-phosphate. And if either of the two compounds are elevated over here, then further test is done to identify which enzyme is present or missing. So mostly clinical signs will help in the diagnosis, and the collection of fetal cells by amniocentesis may be useful in the prenatal diagnosis. So prenatal test for galactosemia involves measurements of both erythrocyte galactose 1-phosphate uridyltransferase activity and the erythrocyte levels of galactose 1-phosphate. And what is the treatment in this condition? Infants will gradually decrease the symptoms when the lactose is removed from the diet, but mental retardation is present, or when mental retardation, when established, will not improve. Hence early detection is most important because it leads to irreversible brain damage. Lactose can be given in the diet after 4 years when galactose 1-phosphate pyrophosphorylase becomes active in the liver. And what is the prognosis? As I already told you that early detection in the newborn has good prognosis, and untreated as well as neglected cases has bad prognosis that leads to mental retardation, cirrhosis of the liver, and ultimately leads to death. And what is the clinical significance? Since galactose is almost metabolized in the liver, galactose tolerance test is done to assess the functional capacity of the liver. Enzyme aldose reductase, which is used for the production of galactitol, is present in lens, nervous tissue, and seminal vesicles. So this is what you need to know about the galactose metabolism.